part of our workshop of policing response to harmful practices presented by Harrar. And if you're joining us for the first time this morning, you're very welcome. What I propose to do at the end of this session is circulate the recordings and the links. So if anybody has missed any part of the workshop, then they'll be able to catch up with the reading that's associated with it. So nobody will miss out. We'll follow the same format as yesterday, insofar as any comments and chats that you would like to share with everybody, please put them in the chat box at the right-hand side of the screen. Yesterday, it was really interesting to see what people had to share whilst Polly was doing the presentation, and we really value that. So please engage, please put your thoughts. It's really interesting to read, and we can reflect that back with Polly at an appropriate time in the presentation. Lovely, thank you very much. Polly, over to you.
Thank you. Thank you and good morning, everybody. Oops. Thank you and good morning, everybody. And thank you for joining us again for the second in the season series of around harmful practices and about policing response. So just bear with me while I just share my screen with you. There we go. So hopefully you can all see my screen. So thank you again and welcome back for those who joined us yesterday. So as I mentioned, we're going to look a bit further into a policing response to harmful practices. Before doing so, what I'd like to do for those of you who weren't around yesterday is just introduce myself very briefly. So I'm the CEO of a national charity in the UK called the Sharon Project, and its aim is very much to support women, particularly South Asian women, who've been affected by harmful practices. So many of the cases that we deal with will involve issues such as forced marriage, honour-based abuse, dowry violence, and of course domestic abuse. As well as being a leading expert on forced marriage and honour-based abuse, I'm often called into court with regards to forced marriage protection order cases, particularly within the family courts. I also sit as the joint chair of the London Harmful Practices Working Group, which is led by the Metropolitan Police, and I'm delighted to know that many of our colleagues from the Met Police will be with us today. On a strategic level, it's really important to influence those who make decisions around harmful practices. And so by being membership-led through various boards and national influencing organisations and groups, it's very important from an NGO perspective to get those views across. Now, the Sharon Project was established in 2008, and it was very much born out of the need, well, the recognition of the gap in service provision for those who had left home due to various harmful practices, but perhaps didn't self-identify or have access to services or support. And I would probably argue that that long-term support provision is still very much required even today. So today we're going to have a look at how COVID-19 has helped to reshape policing and with a particular focus on harmful practices. We're also going to look at the impact that's had on the policing priority around community safety and security. And then a little later, what we're also going to do is look at perpetrator profiling. How can we identify those who are perpetrating harmful practices? And so we're going to have a quick look at some of those models. So I want to just reiterate that these sessions are very much interactive. So please do use the chat, do ask questions. And I'm so delighted to see so many people from overseas here today with us. So when we look at the impact of COVID-19 on harmful practices, we know that since lockdown, there's been an increase in high risk, high harm honour-based cases. What we've also seen is that forced marriage reporting has gone down. And that could largely be attributed to the fact that due to the restrictions in airports, a lot of flights are no longer leaving the UK or entering. And in the last session, we looked at the forced marriage unit statistics to evidence that only 5% of forced marriages fully take place in the UK. So whilst that is a positive outcome, that young people aren't being taken abroad, what we have also seen is that people are using this as an opportunity to start the planning stage and are awaiting those restrictions to be lifted. So it's still no less safe. It's just that this opportunity is provided perpetrators to develop on the planning side of things. We also know that some of the impacts that we discussed yesterday was around children, and particularly around the closure of schools being another high risk, particularly if people within that household are impacted by harmful practices. So when we look at the wider issues globally around the impact COVID-19 has had, we can see that this isn't just a UK issue. In fact, some of these figures that you're seeing on your slide here are very indicative of what's happening globally. But what's really important to recognise is that violence against women and girls was a global pandemic way before we had COVID-19 outbreak. And so when we look at the figures here, particularly around the increase in calls to national domestic violence or abuse helplines, we recognise that these are very significant issues that we do need to address, and that what's happening in one country is reflective of what's going on a global scale. So for me particularly, we found that what was quite surprising was that over 70% of survivors maintained that their abusers had more control over their life since COVID-19. In fact, I have heard stories around perpetrators having so much time on their hands, they're actually using this to concentrate their efforts around abuse. And where people have been furloughed or working from home, as we discussed yesterday, where home is no longer a safe place for women to be, then clearly that is quite indicative of the figures that you are seeing on your screen right now. So what this has actually done is create what I'd call a perfect storm. And within that perfect storm, we have a shadow pandemic, which is the increase in gender-based abuse. And what we can also recognise from the storm on your screen is very much that it is built on or led by excuse me, socio-legal, economic, financial and political areas. So as I mentioned, we know that honour-based abuse and fears of forced marriage has increased. In addition to that, domestic abuse has increased between 20 to 200%, depending on the various services that have provided that data. We also know that women are more likely to be made redundant or risk losing their jobs. Why? Because the majority of workers in certain sectors, such as hospitality and the care sector, are made up predominantly of women. So we know that there is a disproportionate effect that not only COVID-19 has had, but also all the other varying factors, the sociological, the economic, the political, that has led to there being an increase in issues surrounding women's safety. And again, we've referred to the schools, but we've also referred to the limited access to healthcare provisions, resulting in poor outcomes. And this is particularly prevalent in the fears around female genital mutilation, which we discussed yesterday. There's real concerns that young girls are being cut behind closed doors because of the lack of access for midwives and for health professionals to be able to provide that support that would have been required prior to lockdown. So we can see that collectively there is all these varying factors that are taking place, and it can be very difficult to police all of those factors. But what we are going to do is have a look at how that could possibly look. So for those of you who may have attended a previous workshop by Roger Gomes around crisis management, you may be familiar with this slide. And what this looks at is the community safety and security priority for the police. And when we look at this as a priority area for policing, we recognise that there are various branches within that that need to be addressed. So if we start with the community cohesion, which is a key area for policing, we recognise that these are just some of the branches from that that need to be addressed. So, excuse me, looking at, for example, asylum seekers, the impact of COVID-19 has meant that many of the applications for asylum seekers has been put on hold or delayed. It also meant that the detention centres were full, and for many asylum seekers, they were placed in hotels. And in doing so, they experienced or were made even further vulnerable, particularly female asylum seekers, particularly where we've seen reports of attacks on asylum seekers in those temporary accommodations. And then religious groups. Again, we saw at the onset of the lockdown that all places of worship had been closed. And for some, though, particularly those affected by harmful practices, places of worship is a place of safety. It's a place where they can access support, as not just physical support, but also spiritual support. So it's really important that we recognise that the policing of these areas has a direct impact on those who are affected by abuse. And then we look at antisocial behaviour, and I'm sure that we've all seen cases and news reports around antisocial behaviour throughout this lockdown. And again, this is part of the community cohesion aspect of policing, but also has a direct effect on women and girls. We looked at also the restrictions on human rights, and there's been much debate about what's the right thing. Is it your human right versus what's right, what the government are directing for you to do? And that's going to continue. And quite often that then falls into the protests. We have seen since lockdown, certainly in the UK, and I know it's probably the same in other countries, is protests. We've had extinction, what are they called? We've had the Brexiteer protests, we've had Black Lives Matter protests, we've had environmental protests, and all of these protests, again, require policing. But within those protests, within those groupings, there is, again, vulnerabilities that need to be covered. We've already touched on children, but again, when we look at vulnerable groups, that very much is a key area for policing. And where there is domestic abuse within a household, there's a chance, an 80% chance, that the children within that household will have witnessed or been affected by abuse. And I thank the chat for reminding me it's Extinction Rebellion that I was referring to with regards to protests. So thank you very much. So when we look at the vulnerable groups, we also then need to look at the other areas such as crime. And again, we've seen an increase in street crime, particularly with regards to certain areas where lone women are being targeted specifically with regards to street crime. And we've already established that the increase in calls around domestic abuse and violence has made it a significant policing issue. We've also seen an increase in hate crime. And again, this may or may not be linked to the protest aspect, but certainly there has been an awful lot more hate crime taking place during COVID-19. People are locked in their households, and particularly multi-generational households. Neighbourhood disputes are on the increase. So again, we're recognising that within this perfect storm, we have all these other issues that policing needs to address. I've already mentioned the concerns around female genital mutilation. But one of the other things that we can't ignore is modern day slavery. And from a harmful practices perspective, that can often present itself as part of domestic servitude, where people are being held in their homes by their families or in-laws particularly, and made to work from very early in the morning to very late at night, told what they can and can't eat, who they can talk to, where they can go. And this amounts to domestic servitude, particularly where their liberties and human rights have been removed. And that's before we even look at the other branches, such as prevent and terrorism. And but particularly I wanted to touch on was the courts. So again, since lockdown, the courts had closed, and now the courts are slowly reopened. What that has led to is a backlog in casework. And it means particularly for those who are involved in criminal cases where they are seeking to seek justice against their perpetrators, their cases have been put to hold potentially till the middle of next year. With all that pressure on trying to move forward within a pandemic, but at the same time knowing that there is a hearing due much further in the future than we would have expected, it's making those it more challenging for people to want to continue to support those investigations. And the other area which is very significant, and it's an area that I'm particularly keen on, is around multi-agency. We have seen that where previously multi-agency conferences have taken place, they have continued to do so during lockdown. However, it's been very limited, and there's been no one-to-one engagement with, for example, social services with a vulnerable person. And as a result, the information being received and being presented within these multi-agency conference calls has meant that the young person or the victim's views are not explicitly being heard. And again, resources. We have seen that the resources available through social services, through the police, through NGOs and charities and housing teams have all led to a decrease in that multi-agency response that prior to COVID would have been more robust. So when we look at these issues and we see that we started with community safety and security, that actually there are so many further complications and implications on policing. When we put that through the lens of looking at harmful practices, we can see that it impacts a wide range of different harms types that are currently existing. So what I wanted to do at this section is have a chat. And in this section, what we really want to do is to explore what's going on in your country, your police force, in relation to COVID-19 and any measures or steps that have been taken from a community and safety perspective. So I would encourage that if you could use the chat in your box to answer potentially or discuss some of the following questions. Bear with me. So the first question I'd like to just really explore with you is what patterns or trends have you seen from a policing perspective in relation to community safety and security? So this could be patterns or trends with regards to arrests or visibility or community discourse, but it's really important that we look at what the patterns are, what's going on from a policing perspective, or what do you think may be going on with regards to community safety and security? So I'll give you a few moments just to tap into the chat room. Please don't be shy, and just explore what is going on in country from a policing perspective. Okay, I'll present the second question for this section, which is, do you think crimes against women and girls have increased or decreased since the pandemic, and the reason for why? And I think that's a really important question as well, because again, we need to reflect the crime types that are taking place and who they impact the most upon. So I've just seen a message in there now. There's been discussion about this in media and campaigns. Police have highlighted some issues, but it's less clear how police resources have been directed to support this. Okay, I agree. That is a very significant point that's been made there. And I can see there's further comments. I'll try to address them in order. So certainly there has been discussions and campaigns. The Home Office, for example, in the UK, ran a national campaign called You Are Not Alone, and that was specifically to address the increase in domestic abuse in the UK. So there has been a commitment by government, absolutely, towards communicating that domestic abuse is not acceptable and in recognition that being at home is not often the safest place. And it's quite right to question where the police resources have been directed to support this. But as you saw from the previous slide, the police have other community safety and cohesion issues to also address. But at the same time, I know from experience that the police have been continuing to respond to domestic abuse calls across the metropolitan at least. So the next point I can see here is around social groups are limited to 6 and the use of masks has led to a rise of fines being issued, and that's quite right. This alienates the police from the community rather than increases confidence. Further, there's been a believed disproportionality in issuing of fines, and as believed, more people from BME groups are being fined. And again, this raises a really important and topical issue right now, particularly through the Black Lives Matter movement, where it's perceived to be a disproportionate policing towards certain communities above others. And where policing is of the communities for the whole of the community, we need to recognise that there are some disparities within that approach that is being taken. And I think it also lends itself to a further argument or a conversation around the use of masks. Some people feel that it's their human rights not to wear a mask, and others choose to recognise that they need to wear a mask. And this in itself causes quite a lot of conflict, whether it's in the supermarket, whether it's walking down the street. And again, you mentioned around the group of 6. I know as of yesterday, we are currently looking at further restrictions across the UK. And that in itself is causing discourse, not just around amongst the communities, but also amongst politicians and those in power. So again, we can see that that is going to develop further. And I think it is quite right to recognise that these are issues that still need to be addressed. It's almost like they are a veil over the issue, but they actually need to be addressed in more detail. And the comment I have here around the police have, in some forces, told government they do not have the resources to police COVID issues, and the focus is on crime. And I think that is indicative of what's happening across the world, very much so, in that the police already have limited resources. They are already dealing with high-level crimes throughout this pandemic, and yet the expectation is to ensure that the police manage the COVID responses with regards to informing and educating and advising the community and the public to adhere to the restrictions and the guidelines, and as a very last resort to issue fines. But we're seeing that this is very much a postcode lottery, in that different forces are applying different levels of enforcement. And yes, I would agree with the comment in the chat that crimes against females has increased, as they are in the environment of the offender with limited opportunities to escape without alerting the offender. And we've seen this in the increase in online requests for support as opposed to over the phone or in person, which we would have seen prior to the pandemic. And that's where it's quite important to recognise that having safe spaces for women to access support was an absolute key priority at the very start of lockdown. So we had various pharmacy organisations and supermarkets providing safe spaces, but one would argue that we need to go further than that, and actually there needs to be an increase in safe spaces within communities to allow, without detection or judgment, access to support for those who are able to find that support. So I certainly think that we've absolutely need to do more from a policing perspective, but also from a community perspective, to be much more aware that these issues are taking place on our streets, in our towns, in our neighbourhoods, and that also then needs to be supported through policing resource. So I can see that the chat is quite good, which is excellent. The comment here about people do not get married or engaged during this time. Just this morning, I saw a news report about somebody who'd broken the guidance on having a wedding reception by inviting more than 30 people. People are still getting married and engaged. And in fact, when it comes to forced marriages, what we've seen is a potential increase in engagements during this period with partners that have been chosen from them from overseas potentially, but without their consent. But also there's been a risk of or conversations around there being online marriages taking place. And I'm not sure if you recall a few months ago that there was a piece around people using the internet in order to conduct marriages during lockdown. So thank you for those comments, and particularly from Cambodia. That's really interesting to know that that's not the case in country. But we explored yesterday the use of technology, which is really important as a resource and a tool for us to not just detect crimes, but also to ensure that we are able to address those and prevent them from happening in the first place. So I think there was one more question before we move on. How should we act when we see someone might be a victim? And I guess this is a really big question in the sense that it depends on where, when, why, and what. So there's never one size fits all kind of approach to this, but certainly if somebody comes forward and discloses that they are at risk or might potentially be at risk, the first and foremost thing that we must do is believe them. And we saw from the case study yesterday that we need to believe the unbelievable in the case of Banaz Mahmood. But we also know that that is not indicative, that's not a standalone situation, that it continues to happen in the UK. So access to support for a victim is really important. And we know from the conversations we had yesterday particularly, is that the length of time that a victim may experience abuse can be between 3 to 5 years. And it may take at least 37 separate incidences before they're able to access support. And what that tells us is that once they do reach out, if somebody does disclose that they are at risk, then we need to believe them and we need to take it seriously. What we can't afford to do is take no action. That's just not an option. So engaging with local services, specialist groups, and the wider statutory and non-statutory organisations is certainly will go some way towards ensuring victims have the support that they need. But one of the things I do want to stress here when it comes to engaging with victims and survivors is about choice. Saying you need to go to the police or you need to speak to this person is not going to be enough for that person to engage. What we do need to recognise is that sometimes people are just not ready to access that support. And that doesn't negate from the fact that they will then spend that period of time until they are ready to access support, managing that risk by themselves. So checking in, following up is very, very key to that as well. So what I'm going to do is just have another look in the chat before I move forward. So I wonder if there's the question in the chat, and I wonder if there's anything specific being done by the police to try and deal with these situations in Cambodia. And I wondered, Buchanan, if you would like to perhaps say a few words? Because I think it'd be really interesting to hear another perspective. Hi.
Yeah, yes. This is Puntian speaking from Police Academy of Cambodia.
Welcome.
Okay, so I just like to say something about the domestic or about the violence against women in Cambodia.
Right.
In here in Cambodia, we also have violence against women, just domestic violence, and especially husband treat badly to his wife, like he fight his wife, and some people also get kill his wife as well. and our police also respond to the case very quickly as well, and we can control the case. Every case we can control.
It sounds to me that you're facing very similar issues than everybody across the globe, in that the domestic homicides are on the increase during COVID.
Yes.
And it's likely, you mentioned the relationship being husband and wife. And again, the restrictions under lockdown is creating that environment that's magnifying what already existed. And I completely understand that it can overwhelm a police force to suddenly have so many homicides to investigate. And I just wondered, is there anything within the community, within NGOs or within government that is helping to assist in trying to prevent these issues from happening?
Yes. We also get the prevents for the ladies at home. Like the police also take care of women as well. And we also have an NGO to work on the domestic violence to have the community safe from violence against the women as well.
That's really, it's saddening to hear, but also unsurprising, because these issues we see across the whole, the international platforms. But I really do thank you for sharing that with us, because again, it just reminds us how big this issue is. Thank you so much.
Yeah, thank you.
I wonder if I might just go to Javier about the experiences in Peru, very much around the policing perspective and the crimes against women and girls. Javier, if it's possible to turn on your microphone, it would be great to hear your perspective from Peru as well. Okay, well that's fine. I've just seen another question or a comment in the box, and I think this is, we discussed part of this yesterday, and it's put that there have been allegations of rape and dowry murders in India, where the lack of police response has been questioned. And I think this could be seen quite a universal issue, and it's something that we are going to cover in the second part of this session today, around why certain crimes are not responded to in a way that is necessary, and particularly when those crimes are against women and girls. So I really appreciate you mentioning that, because we will be picking that up a bit later on in the next session, in the next part of this session. So I want to just say thank you all for your comments there, and particularly the response from everybody. Because again, having these conversations and understanding what's going on in country helps us to better think and formulate our responses. So now I'm going to take you to what I'm going to do is look at some of those challenges that the police face. And of course, we've discussed and we recognise that budgets and lack of resources of officers is very much so a key issue, generally pre-COVID-19, and certainly more so now. But what these conditions have also done is it's reduced the access to community intelligence to better preempt what may be going on within certain communities in order for resources to be allocated appropriately. And because of the lockdown and because of the restrictions, we have seen a reduction in community intelligence, which perhaps is the hardest thing to gain in any circumstance, but even more so necessary now. And again, in many countries and in many people's views, there is an ineffective response from government, and that could include criticism around clarity, around ineffective practices, and around particular groups are being more affected by the restrictions than others. So certainly these are some of the barriers that we can continue to recognise. And one thing that was definitely apparent, particularly on a global level, but certainly across the UK, was the lack of PPE. That also had an impact on a reduced community policing response and the lack of or reduction in contact with the public by the police. And I know that certain forces and certain have different approaches to the wearing of PPE. I certainly know from a London perspective that when I see police officers on the street, very rarely do I see them wearing a mask. And again, it's about having that community engagement, about that visibility within communities. But the lack of PPE has certainly led to a huge reduction in community policing and contact, which was perhaps already strained with the public. And then we've got, of course, crisis management. We recognise that prioritising national safety is always going to be high on the agenda. And as we heard from Cambodia, certainly, at what point do we prioritise domestic homicides and violence against women and girls against the barrier of, for example, terrorism or other national security issues? So certainly that has played a significant role in the resources that are available to police these issues. And again, we recognise that education and training cuts has then led to limited knowledge. And whilst education is an absolute key in policing, it also means that there's greater awareness of the current issues that are impacting the general public. Then we look at the fear of infection through local lockdowns. And this is, again, is something that was added into the chat as at what point do police start policing restrictions within local lockdowns and placing themselves at risk in doing so? We saw across the world, and certainly here in the UK, the campaign towards supporting the NHS, everyone doing their part to ensure that those infection rates were gone down. But as the pandemic and as this virus continues to progress, we are seeing local lockdowns and potentially even another national lockdown. And how do you police around that environment when that fear of infection hasn't gone away? Another area of concern and a challenge for police is around overcrowding in prisons. And what I've certainly seen since lockdown is an increase in persons who have been charged or arrested be released from remand onto a licence or bail, quite simply because there is nowhere for them to be detained, and secondly, there's a question around infringement of their human rights, particularly where the closure of courts means that the backlog would involve 6 to 8 months before a further hearing. So certainly that is also playing a wider impact. And some of these cases with regards to being released on licence or bail are quite serious offences, and they're being returned back into the same communities. So again, this also presents further challenges for us all. And as I mentioned around the closure of courts and the backlog, we also see that, as with the police, as with the health service, judges are also reducing in numbers with regards to being unwell or needing to self-isolate. And again, what this has done is having a knock-on effect of all the other issues and the challenges that the police face, but also that we face as a community. So rather than the doom and gloom, what I really wanted to do was have a look at what the police have in their toolkit. What can they currently use in order to address harmful practices through COVID-19? Well, we know that they have the power of arrest, but quite often that's not as straightforward as it can be. And in the second part of this, we'll look at some of those models whereby the type of crime can have an impact on the arrest period for those cases. We also know that there are various protection orders that can be issued. We have the domestic violence protection notices and protection orders that can be used. Alongside that, we also have non-molestation orders, and these are still being issued throughout lockdown. And then we look at the Domestic Violence Disclosure Scheme, which is also known as Clare's Law, a register of recognised perpetrators of domestic abuse, which can be made available for those in a relationship and who suspect domestic abuse and want to find out more. And again, this is very much a preventative issue because having foresight will help to inform how we move forward. We have 12 specialist forced marriage courts across the UK, and they have been open throughout this period, and they are specifically there to address the cases around forced marriages and to issue forced marriage protection orders. And this is particularly significant because these particular courts will have the judges will have the experience, knowledge and training to better understand the nuances that alongside forced marriages, there may be other issues such as honour-based abuse, which would then lead to further risk. So it's quite important that we recognise that that is a tool that we can continue to use. I also mentioned about multi-agency conferences, MARACs as we call them here, and also access to charities and NGOs. And again, whilst that is continued throughout this period, I suspect that perhaps the need for further multi-agency conferences and support from NGOs is increasingly more needed now than it has been before. And I know from a personal point of view that we've engaged with various police forces and officers on various cases since lockdown, more so than we did prior to that. So again, it just highlights the need for partnership working. And then we also have our various risk assessments, the merit or the dashboard. Now, these assessments really help to identify the different types of risk that could be presented for a victim, and therefore the safeguarding approach that is going to be required. But again, these can be quite cumbersome, and some questions may be missed, and those questions may then lead to further risk not being identified. So again, having these tools is very useful. And I mentioned around the protection orders, and we also have FGM protection orders, where there is a risk or identified risk that a young person may be at risk of being cut. And again, these protection orders are quite easily obtained, but they do need, because what they don't need is evidence, what they do need is reasonable grounds. And so again, it's really important that we use what we currently have in our toolkits. And then we have the body worn video. And I think this is particularly interesting time for us, because when we look at the use of technology, body worn videos is certainly being used to help with creating what we call victimless prosecutions. And in cases of honour-based abuse and forced marriage, where the victim may feel that they don't want to criminalise their families, they don't want to send them to prison, the use of body-worn video has been really instrumental in capturing what is going on without the need of the victim's statement. And then furthermore, we have the aid memoirs, which are coded within various police forces and available online for them to better understand some of the nuances of some of these harmful practices by accessing some of those resources. We do have some resources in the materials with regards to an aid memoir, a version of an aid memoir that which we've created around harmful practices. So we've seen what we have in our toolkit, and there may be other things that you have in your toolkit, for example, that we can add to that. And at this point where we have lack of resources, and lack of manpower, if it's so to speak, we also need to see what we do have and build on that. I'm looking at the chat as we're going along, and what I also want to do is encourage further conversations, and we will have a section on questions, and so I would really love to pick them up there as well. So I think that would be really useful. Thank you. I also want to look at what the barriers are, because again, we can have all these tools, we've looked at the challenges, but the barriers haven't gone away. So again, as I mentioned, victims may be unwilling to support police prosecutions. And that could be for the reasons I mentioned around not wishing to criminalise their family. It could be because in doing so, they would bring shame or be ousted, I should say, or disowned by their families or communities. So the long-term repercussions for the victims to come forward is quite vast and quite often long-term. Further, we have gaps in our intelligence surrounding crimes, and that could be due to lack of information. And that lack of information can easily come from a lack of trust within the community. We saw in the case study that we looked at yesterday with Banaz, how the community colluded together in order to distract the police from undertaking their investigation by providing false information. And we hear time and time again that the community has shut down, they've put up a wall, they won't talk to the police. And it's from that lack of trust, potentially, that those communities are adhering to those practices, but also because potentially they may agree with the crimes that have taken place, as we saw yesterday. We also have barriers around lack of language skills in those with unstable immigration status. The very real fear of coming forward, of not being heard or understood, or fear of being victimized for being the victim. So absolutely, we need to look at all those issues, and particularly around repeat victims. If a victim contacts the police 5 times and still nothing happens, or God forbid, loses their life, there is clear loss of confidence in the policing response. And that's why we need to ensure that our first response is the right response. So just going to move forward slightly more. So one of the ways in which we have seen one of the responses around community intelligence, community-led intelligence, was an ask, if you like, by the Metropolitan Police to work with partners to protect victims. So what the method said was that they needed the trust of partners, clients and service users that we support in order for us to be able to be encouraged to share information as to reduce risk of offending and identify safeguarding opportunities. And again, because it's not always about the prosecution, it's about reducing the risk and ensuring the safeguarding for those victims. And what they offered was a sterile corridor for information once provided in order to assess and develop it into intelligence. And it was really clear that what they were doing is encouraging us to share intelligence and not to report a crime, because of course that would need to be taken in a different direction. But what was also really interesting was that they also presented to us what intelligence is. And you can see them listed here. And it was any information obtained firsthand or anonymously that can be developed into the following: in order to assess threats, in order to reduce risk, to provide safeguarding opportunities, protect victims of crime, apprehend offenders, and assist with prosecutions. And again, this response from the Met Police was very much around being partnership-led. And I can't stress enough the impact that this particular process has had, particularly over COVID. As at the early start of lockdown, we had what we called COVID-19 calls. So the partners would collaborate and get online and talk about what's going on in their communities in their neighbourhoods on their services in order to better understand what is happening with regards to harmful practices. This in turn was translated into intelligence that allowed police to be alert, to be able to assess threats and be able to respond directly to the concerns that were being raised by the partners. And it was certainly something, a model to be encouraged. And I wonder if there is anybody here from the Met Police who would like to potentially just comment on that.
Hi, Polly. Sorry.
Hello.
It's Sharon Tracy. I'm a DC that works on the team you've been referring to.
Fantastic, Sharon. Welcome. So from your perspective, with regards to the partnership working, what are your thoughts on how this model is working?
I think it's just given us a better understanding and insight in terms of where we need to focus our some of the media messages, and to let other officers within the command and the BCUs know what the risks and concerns and the trends that have been identified.
That's great. And you mentioned around the comms, because it's not just around sharing intelligence or information, it's also about sharing key communications that affect certain communities that are most affected by harmful practices. So absolutely, I think that's really key as well, that it's not just an intelligence led, it's also communications led, and that is best done through a partnership approach.
Definitely. And also we identified that due to COVID, exactly as you've been saying, the access to services has been significantly reduced for people, plus their ability to be able to access them. And it was just looking at how collectively we could get the message out that we are there, partners are there, and perhaps just think of different ways in which they could communicate and get support and help as well.
Fantastic. That's really useful. And when we looked at the challenges, Sharon, are you facing similar challenges to what we discussed just a moment ago with regards to resources, engagement with the public?
I think because officers are being pulled from one in multiple directions, it is really quite difficult. But the people who are on the ground are working hard. They do still have the resources, albeit they're really stretched. We've looked at reintroducing harmful practice advisors. So that's to make sure that officers have got a bit more in-depth knowledge and have got a better understanding of what specialism and what partners and support services are out there. Because as you said, a lot of the time people don't want to go through the court process, but they do need the support, or they need the support before they do go around the court process, because they can end up being ostracised by family, community, and a lot of time, as with, like, for example, child abuse, children do go back, or families do go back to what they know because it's better than being on their own.
Yeah, absolutely. Thank you for sharing that with us, Sharon. I will be referencing the working group again in the next part of the session. So thank you again for that insight. Really appreciate that.
Oh, you're welcome.
Okay, well, thank you, Sharon. Okay, so we're going to move straight on to where this sits, with thanks to Sharon for sharing that information around the London Harmful Practices Working Group. What you see on your slide here on the right-hand side is where the harmful practices remit sits within the Met Police. So you'll see that as part of the working group, it then feeds into various sources. It goes straight through up to the national level, but also has a correlation with the governmental sort of policing structure as well. And so this structure very much is very crude, but very defined response to how harmful practices influence the policing and the government structures around addressing these issues. So you'll see from the working group that it then feeds into the national working group. and then it goes further up until it gets to the national crime aspect and the coordination. But alongside that, what we also have is that it feeds into the Home Office's FGM unit and the Home Office and Foreign and Commonwealth Office's forced marriage unit. So again, it's very much around partnership working, and it's about collaborating, which in turn then move forward and increase right up to the Home Secretary. And so whilst there is two aspects to this particular slide, one is the operational side and the other is the strategic side. So certainly, if anyone was wondering where harmful practices sit within a government or a policing structure, you can see that it feeds across all streams of those areas. So I think that's really important to recognise that these harmful practices isn't a standalone issue, it's an integral part of what we're doing within policing. So now I had some questions here, and then we're going to go into a break. What I'd really like to do is invite our colleagues to come into this and really share your insight too. And again, very similarly, what we're asking here is, what crime types have you seen in country during the pandemic? Are you seeing more burglaries? Are you seeing more high risk harms? Are you seeing more organized crime? What kind of crime types are you looking at? And then I would want to ask, well, who are the primary victims of those crimes? Who are the main victims who have been affected by the crime types that you're seeing in country? But then I also want to ask, well, who are the perpetrators? Who are the primary perpetrators? And I put that as a plural because quite often, as we've recognised, when it comes to harmful practices, there are often multiple perpetrators. And so just looking at that, it would be really interesting to get your thoughts on what kind of crime types you're seeing in country and who the primary victims are and who the primary perpetrators. And I suspect from a harmful practices perspective, those answers are quite obvious or quite apparent. But again, it's just asking those questions. And if we recognise who the primary perpetrators are, then what more can we do to ensure that we're taking a targeted response to address those particular crimes? And I wonder if there's our colleagues from the National Crime Agency on this call, and if they would like to respond with regards to whether they feel that, for example, harmful practices should be considered as a serious organised crime. And also if there are any parallels or comparisons that can be made internationally to our international colleagues. So when looking at the crime types, should harmful practices be seen as serious organised crime? And I see in the chat, we've got in Peru, domestic violence, child abuse, fraud, cybercrimes and corruption. For me personally, I believe that they should be seen as serious organised crime, because the very nature of the planning and the execution of these crimes is so vast, and the impact is so high, that we really do need to look at these issues. And I'm just looking in the chat again around an increase in organised crime networks dealing with drugs. Females are primarily in home environments and organised gangs and male partners in relationships. So again, it's looking at the correlation of who the victims are around that. And again, looking at the chats that in London during the pandemic, there's been an increase in petty crimes such as stealing bikes, food from shops and mopeds. I know that those, what we'd call street crime, actually has a wider impact on the victims of those crimes as well. So just looking at the time myself, what I would like to do at this point is to invite some questions and then move to a short break before we cover the second part of the session. So I would like to invite, if anyone's got any questions, they'd like to unmute and ask a question or pop it in the chat.
Polly, can I just raise a question? Can I just raise a point made by Javier about the Peruvian experience, which is very relevant to Rod's forthcoming workshop next week about police legitimacy, the role of police and how people respond to sort of messaging and government messaging. His point is that in Peru, people don't believe government messaging, that there's a sense of fake news and they therefore don't respond to the messaging. And I'm just wondering how that relates to the position of the government here around this issue and the sort of that relationship, and whether that, you know, what your thoughts are on that.
Yeah, no, absolutely. And I think one could argue that a proportion of our population do not believe in our government. And it's because this pandemic is so unknown on a global scale. But where there is distrust in government, and this isn't just Peru, I turn on the news and I see this particularly from young people, but globally there is an issue around support or recognition or the legitimacy of government's role. It is an issue that does need to be addressed, and it can be very difficult to try and find a solution when the very people who are appointed to govern are not trusted. And I guess the question there would be why, and where that breakdown of trust in that government has taken place, and what more can be done in order to restore that trust, if at all. And I think then what countries tend to do is look inward to see where they can receive trusted information, where they can create local solutions. And I can see in the chat there is a deterioration in trust in the UK with our government. And so whilst I don't have an answer, unfortunately, I can relate to and quite clearly understand that where there is a breakdown in trust in government, be it through corruption, through manipulation, through distrust from the community in the way that they are being treated, it can further increase the barriers and challenges that we currently face.
Yeah, I was just wondering as well in relation to harmful practices, in some cases where people don't experience the crime themselves, they don't see the priority of it if they're only hearing about it through other people's experiences. And I was just wondering whether that's an issue with harmful practices and how that messaging cuts through that.
Yeah, I mean, again, is almost like a double-edged sword. We need government's involvement and commitment to address harmful practices, and at the same time, if there isn't the trust in a government, then it almost becomes a bit of a moot point. I know certainly here in the UK, the government a few months ago held a harm conference summit looking at harmful practices, making the recommendations. You saw from the earlier slides how harmful practices is very much embedded within a policing and then right through to a governmental point of view. But having that knowledge and that strategy and that resource there in itself isn't enough. It needs to be backed up by resources, good, clear communications, not just generally, but specifically around those issues. So certainly I would say that more still needs to be done, but I would certainly be naive to not think that the government are doing something right now. I would just like to see them doing more and pushing that agenda further. Thank you. I wonder if we can take a short break. We still have, when we come back, it sounds like a program, but when we come back, what we will be doing is looking at what a perpetrator looks like in relation to harmful practices and some frameworks that you can apply or consider with regards to identifying the risk towards safeguarding those affected. So I wonder if we can put the clock, let me just have a quick look at the time. So it's coming up to just 4 minutes past 10. I wonder if we can come back just by 15:15 or just after, say, 10:17. Does that sound okay?
That sounds perfect. Thank you.
Thank you very much.
Thanks, Polly.
Cheers.
Polly?
Oops. Yes?
Polly.
Sorry, it's Sharon here.
Hi, Sharon.
I haven't got access to the internet, so I don't actually know what you're looking at. So I just thought I'd mention that in case you go, oh.
No worries, Sharon. All the materials are in the material box, but we can share them with you afterwards. It'd be great for that to, we could potentially share that with the Harmful Practices Working Group as well.
Yeah, that'd be brilliant. Thank you.
Thank you.
While I was thinking about it, I'll let you have a break now. Thank you.
Just for the benefit of everybody, after the session's finished, we'll be sharing the recordings and any related material and links for your benefit.
Thank you.
Hi guys, and welcome back. I believe we got just over 15 minutes. So I'm going to push on because we've got quite a lot to cover yet, and I'm sure this next section is going to be of quite a lot of interest. So what we now want to look at is perpetrator profiling. Reason being, if we know that these crimes are taking place and we know the behaviours and the characteristics of the perpetrators, how can we best identify and approach a policing response in order to address these types of crimes? So the first question I would often ask is, what does a perpetrator look like? Well, we know that it crosses gender, nationality, faith, age. Anyone could be a potential perpetrator, and particularly with regards to harmful practices, and in particular honour-based abuse, we see that it involves multiple perpetrators. Now, in the slide there you see around 1 in 4 perpetrators are repeat offenders, and some have as many as 6 different victims. Comes very much from an initiative called the Drive Project, which works with high harm, high risk and serial perpetrators of domestic abuse. And they work to prevent their abusive behaviour and to protect victims. The high risk, high harm perpetrators are those who have been assessed as posing a risk of serious harm or murder to people that they are in intimate or family relationships with. So this initiative, the Drive Project, challenges these perpetrators to change and works with partner agencies like the police and social services in order to disrupt the ongoing abuse. So it advocates to change the national system so that perpetrators posing all levels of risk can no longer get away with abusive behaviour. Now, that might seem like a very simplistic approach, but actually, in doing so, this particular initiative worked with NGOs who work with perpetrators, as well as organisations who work with victims. And this has also looked at addressing the gap in identifying high harm perpetrators of domestic abuse. And as we looked previously in the last session, what we're dealing with here is homicide reduction or management at this stage during lockdown and COVID. So when looking at what a perpetrator looks like, we are already influenced by gender profiling of the victim being meek and weak and small and submissive. We look at institutional inequality, what's going on, whether it's within a police force or whether it's within governments or whether it's within other sectors and organisations. But also, we are quite often influenced by cultural norms or expectations in country. And quite often where those norms go unchallenged, they can almost become normalised. And again, that feeds into the unconscious bias that we all hold. And for some, may not be aware of their male privilege or the male privilege provided to others. And that too can help to identify some of these issues. What we also need to recognise is that women can be perpetrators too. And that's really important when we are trying to identify what a perpetrator looks like, because mum, granny sitting in the corner, auntie, a member of the community, they can all be either complicit or involved in the planning and the processing of that particular crime. Then we also look at perceived positions of power, particularly in communities or societies where of male dominance, where positions of power can influence the way you view other people. For example, perpetrators can often be doctors or GPs, they could be judges, they could be people within government. So having that perception of power can often undermine what's going on below that. And we also look at things such as the differing approaches based on our own personal experiences or the needs of our communities. These all help to shape what we believe perpetrators may look like. So I wanted to just briefly, and it will be rather brief, touch on 3 particular cohorts of perpetrators in order to assess identification. So the first group is the high harm cohort. This group is very prominent in the sense that, that they present the highest risk of harm or injury or attempted murder or serious aggravated assault. And whilst the number of these crimes might be low, the risk to life is so disturbingly high that we can't ignore it. The second group is the repeat offenders. Now, this group is particularly known to the police, is constantly being reported for domestic abuse, and it may be for other crimes too. And because they're often known to the police, it also means that there is a repeat pattern of behaviour offences towards victimisation. And this could well be a key focus for the police to use their existing data on known repeat offenders in order to target them better. And then there's a third, which is the Regency Frequency Gravity Cohort. Now, this particular approach looks at how often the number of incidents that take place, the severity of those particular offences by placing scores on those, and then the period in which the offending took place. So there are pros and cons on all of these three cohorts, and we're just going to explore them further. But before doing so, it's really important that we also recognise that cross-border or roaming perpetrator identification, where abuses and crimes take place in multiple locations, can also be used as a hybrid approach to gauge a more national or regional picture. So when we look at the high harm cohort, and this is particularly prevalent in honour-based abuse cases and honour killings, we know that we're dealing with high-risk cases and operating on a homicide prevention mode. And the reason being because we know that these particular cases involve multiple perpetrators that are very well organised, and they are highly motivated and quite often well protected. Now, on this slide, I've only put a snapshot of some of the most prevalent cases around honour killings, particularly in the UK. But we know that this list goes on and on and on. Again, we're looking at those with the highest risk. The first picture you have on your slide there is Banaz Mahmood, and we discussed some of her situation and her case study yesterday. But the person next to her, Shafilia Ahmed, who was an A-grade A-level student who just wanted to become a lawyer, but her parents thought she was becoming too westernised and decided to take her life by strangling her and suffocating her in front of all her siblings, in order to teach them a lesson that if you disagree or go against the family's values, then the same could happen to you. And then we have further cases across the board, including cases that have taken place where there has been an international element, whereby victims of honour killings have been taken abroad for the purposes of murder. So when we look at the high harm, what we see is whilst the frequency, the number of cases is quite low, it stands out purely because of its high impact on these particular types of crime. And it's often discussed in multi-agency conferencing. And more significantly, they're the cases that make the press and the media. And here I just wanted to highlight just some of the consequential impacts of this high harm. Alicia was the youngest victim of an honour killing in the UK, where her brother was seeing a girl within the community, and male members of that same community disapproved of that relationship and set his house on fire. Unfortunately, Alicia didn't make it out. So again, the high risk and the high harm is significant because the risk to life is greater. And then we have this father here, Mohammed Riaz, who disapproved of his daughter wishing to marry somebody that she chose. And before she was due to fly out to marry her partner, he set his own house on fire in an arson attempt in order to prevent her from bringing shame to the family. So what we've seen from this is that there's been a move from the London Domestic Homicide Review that took place last year in order to draw on this new cohort that exists to ensure that we are able to look at the offences and the escalation of the patterns of behaviour of this particular group. And then we move on to the Regency Frequency Gravity group. This is just a very quick snapshot of how this particular data set is established. And it was created in Scotland by Strathclyde Police by looking at vast volumes of data and mining those in order to assess offenders and victims on 3 key areas, as I mentioned, around frequency, regency and gravity. And what it did was it looked at how that could help to best identify further offences. So when we move forward and look at the next group, it references the Cambridge Crime Harm Index. Now, I know that in another workshop next week, my colleague May Britt will be going through the Cambridge Crime Harm Index in more detail. And what's interesting about this particular approach in identifying perpetrators is that it has been adapted globally through New Zealand, Denmark and Australia, and through other police forces here in the UK. And what's interesting about this particular approach is that it looks at offenders with no prior convictions, whereas the previous 2 can also look at previous offences. So when we're looking at the considerations of these types of approaches towards identification, we can see that potentially that the repeat offender cohort is perhaps the best tool for identifying repeat offending and therefore repeat victimisation. And that's because this particular group is quite entirely filled with those who are in intimate relationships or unique relationships. And it also but what it also does is it focuses on offences that are the least serious from a harm perspective. But the combination of all of those separate low harm offences are magnified when they're put together. And again, when we look at the high harm cohort, it looks at the most controlling offences that represents the highest custodial sentences. So again, when we just look at the RGF cohort, that also can identify the seriousness of offending or the gravity of that offending by using the scores applied based on physical violence only. And what that means is unless there is a physical injury, what it doesn't do is capture crimes such as rape, stalking and controlling coercive behaviour. But because it identifies the most subsequent harm out of the 3 cohorts, because it's linked to how often, within what period and what severity of the offending is, it can be seen as quite effective. And it also, as I mentioned, includes individuals who've not been known to the police prior to those offences taking place. So when we look at recommendations with regards to how we can best look at responding to harmful practices, many forces and structures hold a equivalent or a similar parallel to what we call the 4 Ps. And you'll see that prevention is very much about detection and stopping the crimes from happening in the first place. And again, this is where community safety and cohesion certainly falls into. But also protection, which is largely around safeguarding, and certainly in matters with regards to harmful practices, as we've heard, many victims don't favour a conviction rate, but they just need the safeguarding to ensure that these harms stop. And again, cannot reiterate enough the importance of partnership working and collaboration as a key part of any structure, but also pursue. And pursue in some views might be seen as prosecution, but from a victim's perspective, it's their sense of justice. They just want the abuse to stop. They just want to be safe. And so for that reason, as the sense of justice based on a policing perspective of prosecution may conflict with the victim's perception of justice. So we need to, of course, ensure that more women and girls are able to come forward who have experienced abuse to report this. But in doing so, we also need to invest in our judicial systems and our legislation in order to ensure that vulnerable women and girls are afforded those protections. And then that also needs to be developed into a partnership approach with key stakeholders in order to restore the trust in policing where that has been lost. And again, the investment in training and education at all levels of policing needs to be consistently throughout a police officer's lifetime and not just at the entry level. And creating a policing strategy that's transparent and accountable and also deliverable, given the circumstances and the challenges that policing face, also needs to be looked at. The most important thing for me certainly is to improve the policing response to the one chance rule. Again, that you may only have one chance to save somebody's life, you may only have one chance to respond, and that response needs to be appropriate. We also then need to look at what other referral pathways and access to services there is for those victims once the police investigations or engagement has been completed. And again, to be more innovative, look through technology and community intelligence to further build the information that you have. So in summary, the key messages is very much that whilst information sharing is vital, it's only required where it's relevant, and that the framing of a police response needs to make safeguarding personal to that victim and not safeguarding that is appropriate or relevant to that individual or that institution. It needs to be personal to the needs of that victim or survivor. It's also important to remember that whilst data tells us a lot of things, it has many limitations. And the biggest question I would ask you to take away is the and question. And what else is going on? And what other crimes are taking place? And who else has been affected? And what other victims or witnesses do we need to look into? But also we need to be more, apply our professional curiosity and look at the it depends question as well. Because we know that each community has a different set of beliefs and practices, so the one size doesn't fit all response is not appropriate. And we also need to look at geography. It's okay to ask questions about how things work within certain communities, and it's also important to look at the international geography of certain crime types, because we know from a cross-border perspective that quite often those crimes are not exclusively in one area. And the last question we have here is, we don't know what we don't know. And that might seem quite simplistic, but if we haven't the information and we haven't the intelligence, then we can't know what's going on. But there's a follow-up to that, is that we need to build on what we do know, use the resources and tools that we do have in order to ensure that we apply, for example, the one chance rule. At this point, I would like to encourage you all to watch this short animated film called Our Girl. A link will be made available after this session. It's a short 3-minute film, but what it really does is it highlights the impact that harmful practices have on young people. It can also act as a discussion point or as part of a training or learning module for you to take away to your groups and your organisations. And at this point, I'm mindful that I've slightly gone off time, but I just wanted to know if there were any questions. I'd be more than happy to take them. I'd also like to take this opportunity just to remind you again that we are looking for some creative writing. We would love your input on how you found these workshops, and particularly on drawing on your expertise and skills with regards to developing some recommendations or approaches to how a policing response to harmful practices. In the materials section of this workshop, there is a document that you can download which includes these questions. And it may be that you have your own views of what can be done better or could be done in a different way. So I would like to welcome your views on that, and then just say thank you again for your time and your patience and taking the time to reflect on how we can work together to ensure the policing response to harmful practices continues. Thank you so much. And Karen, I just wondered if you wanted to add anything further at this point.
No, I just want to say a massive thank you, actually, Polly. That was superb. and particularly good because so many people got involved within the chat and wanted to share thoughts and experiences. So absolutely brilliant. So thank you so much. Excellent stuff. I would just like to look forward as well. We have 3 more workshops coming up next week and the beginning of the following week. Monday and Tuesday this week sees a cybercrime presentation by Graham McGowan, looking at the threat landscape and inviting participants to engage in an exercise. And then Wednesday and Thursday, we'll be discussing the problems that 2020 have posed for the police in terms of the issue of legitimacy and their relationship with the public. And Rod Jarman will be leading that workshop, and that ties into the point that Javier made earlier, which would be really interesting. And then, as Polly said, May-Britt Ronnebro from the IPA and Sweden's National Police will be presenting a workshop the following Monday and Tuesday about the way that countries, so different countries, have actually maintained police delivery throughout the pandemic, which again will be really interesting. So if you want any information about any of those, please just drop me a line on conference 2020 at longpolecole.co.uk. But thank you everybody for taking part in this. We'll be sharing the links, the PowerPoint probably, and certainly the recordings of the sessions later on today or over the weekend. So thank you, and goodbye, and hopefully see you at one of the other ones next week. Okay, bye-bye.
Bye-bye, Karen.
Bye, Pac.